This is a short video to demonstrate the results of searching for Peter Doshi flu vaccine on YouTube on May 30th, 2020. And this appears to be an example of so-called shadow banning or stealth censorship on a particular topic. So first of all, let me just say who Peter Doshi is. Peter Doshi is a prominent critic of the Centers for Disease Control's language and numbers on influenza and pneumonia and also about the flu vaccine. So he has a Ph.D. in science studies from the Massachusetts Institute of Technology, MIT, and this is his Ph.D. dissertation, which was published in 2011, and it has very detailed critique of the numbers and language on the CDC website as of 2011. So you can download it here if you want to. It's pretty lengthy. Here we go. So Science, Technology, and Society program at MIT. And he's been very active in things like the Cochrane collaboration and various activities for so-called evidence-based medicine. So here's an article from 2013 that he wrote in the British Medical Journal, one of the most prestigious medical journals. He was a contributing editor there. This is an earlier article that I've referenced also in the BMJ, the British Medical Journal, in 2005, very much critiquing the numbers on the CDC website and their reports and scientific articles back in 2005. So are U.S. flu death figures more PR than science? Peter Doshi, and he's at MIT at this time. Well, the point is he's a serious scientific critic of the CDC's numbers, and indeed when I was reviewing their influenza and pneumonia figures and their influenza and pneumonia statements on their website and their reports, there's a lot of very contradictory, confusing numbers and claims and unexplained things, a lot of different stuff. So this is in fact a reasonably credible person, and he has really substantive points to make. However, let's show you what happens, at least for me, when I look for Peter Doshi flu vaccine. Bang, here we go. All right, so these are what come up. Not a video with Peter Doshi, but a series of videos which appear to be basically promotional videos for getting the flu vaccine. They have nothing to do with Peter. And then we come to related to your search. Keep in mind this is related to your search. Many more of these are fairly positive. It skips along here. We go down further and further. And by the way, this one I actually watched for a while. And although it says rethinking influenza disease, it also appears to be basically promoting the vaccine. So we keep going. And finally, way down here, after scrolling a long way, we actually find one of the videos. And there are several videos related to the flu vaccine still on YouTube. One wonders how long they're going to last. So this is a short interview he did with I'm not sure what to call it, radio show, something like that, 6 years ago. And this is scientists warning against flu shot. Scientist at Johns Hopkins is Steve. And this is a short explanation of his position on the flu shot. So he says he doesn't take the flu shot, and you can listen to this if you want to and get a kind of quick version. Now, this video here is also actually closely related to influenza. Tamiflu is a drug that was marketed and claimed to help with the H1N1, the swine flu epidemic in 2009, and governments spent apparently, reportedly, billions of dollars stockpiling Tamiflu. And working with the Cochrane collaboration and others, Peter Doshi is one of the people trying to track down the actual data and evidence that, in fact, Tamiflu was beneficial. And so this is him talking about his attempts to confirm this. And actually, he found all kinds of, basically, his position is basically nothing. There's no real evidence that Tamiflu actually worked. But again, if this search was doing what you would expect a search to do, this would be right at the top, because Tamiflu is closely related. Admittedly, it's not technically the flu vaccine. It's a drug for treating viruses, supposedly, and specifically influenza. So the flu vaccine is, in principle, a vaccine for various categories of influenza. And again, most of this stuff is very positive. Here's another one of the Peter Doshi's actual articles. And again, here it's a more general comment on trying to get underlying data, the clinical trials data for evidence-based medicine, and how difficult that has proven to be in many cases, including those related to the treatment of influenza. Um, so this is, not only is it all buried and related to your search, but this one in particular is specifically about the flu vaccine. There's no question it should be what comes up first. And it's virtually, most people would probably give up if they did do this search on YouTube or possibly watch one of these other videos instead of actually listening to what Peter Doshi has to say. And as I said, he's actually knows a lot about what he's talking about, and many of the things he says in his dissertation and in these articles in the British Medical Journal matches up with what you find when you look into the CDC's claims about influenza. So this is, it seems to me, pretty clearly some sort of what I would call censorship. It's an interesting question. YouTube and Google are funded by advertising. How much advertising do they get from the pharmaceutical companies that market the flu vaccine in concert with the Centers for Disease Control? That's an easy explanation for why we get this result here. It's certainly highly questionable. And it also should lead us to think, well, do we need to get new search engines that are not advertising supported, or at least disclose the role of advertising? Like if this is here at the top because some pharmaceutical company that markets and produces a flu vaccine wants it to be there, we have no way of knowing that, do we? Right? There's no apparent law requiring them to disclose this, and in practice, I've never seen a search engine that discloses the funding that they're receiving from interested parties for these search results, sort of advertising or whatever. So that concludes this video, which was produced on Saturday, May 30th, 2020. And I think, again, I would leave you with YouTube search results can be very, very far from what they ought to be. This concludes this video presentation. If you like this video, please click like. Please click subscribe and the notification bell if you would like to receive more content from us. You can avoid internet censorship by subscribing directly to our RSS news feed. Please consider sharing the link by email or on your website or blog, in addition to liking, upvoting, or sharing on increasingly censored, advertising beholden, and big company social media. We have encountered such censorship. Mathematical software is developing software to automate data analysis, reducing the risks of costly errors and improving results. You can support our work financially by subscribing on our Patreon page. Scan the QR code in the lower right corner to get the Patreon link. Our Patreon link is also in the show notes below.